Hello everyone, and welcome to the first ever episode of Kick Out Podcast Zimbabwe. Today we're joined by 3 panelists and I shall give them a chance to introduce themselves. And before I forget to introduce myself, my name is Rati and I'll be your host. So the first person that I'm going to ask to introduce themselves is our drug demand reduction specialist. Please may you give us your name and what you do.
Thank you very much. My name is Brighton Mufakwa. I'm a drug demand reduction specialist. So I have quite a number of hats that I wear sometimes, but I'm happy to be here. So thank you for engaging me.
Thank you very much. So today our hat is the specialist.
Drug demand reduction.
We love it. Next we're going to have our clinical psychologist introduce herself to us.
Afternoon everyone. My name is Stella Mbilibili, clinical psychologist working widely with different mental health challenges.
Great, thank you so much. And thirdly, we have somebody who's part of the ActionAid, the people who've brought us here today to give us their research, to just give us this conversation and an opportunity for us to have a chat. Please may you introduce yourself.
Okay, thank you so much. So my name is Ano Chitoto. I'm a young researcher in terms of issues to do with drugs and alcohol abuse.
All right, great. And joining us, as well as our panelists, is an audience filled with people from Hopley who conducted the feminist research in 2023. And they will answer questions and give us more info as to this research that was conducted. So as we begin, I'm going to ask 3 questions for our panelists, and you can choose who wants to answer first and who would like to answer which question. So the first question we're going to go through is, what is your perspective to the prevalence of drug and substance abuse in Zimbabwe among the young people? So Mr. Brighton, would you like to just take us through?
Okay.
Yeah.
Thank you very much. So first thing that I would like to talk about is the research gap that we have. We are in the process of doing situational surveys or national situational analysis, and all the surveys that have been conducted to date, they've been limited to provinces. So there are some researches that have been done by civil society, and there is an indication that there is widespread use of drugs, and also the data that we are collecting through the health centers that are around the country. There is widespread use, although it's very difficult to verify at the moment, but we are, according to the Global Status Report, we are one of the countries that are leading in terms of substance use and also alcohol use. So that's, in a nutshell, that's how I can put it for now.
Yeah. All right. Ms. Stella, would you like to contribute or add more to that question?
I would say there is an increase, which I suppose all of us are aware of, and we are very concerned. And as my colleague has said, there's a research gap, but there's also a facilities gap in terms of what do we do, who do we consult, and just an increased awareness that mental health covers substance abuse, that it's actually a disease as opposed to just a habit that people can deal with. We need a lot of specialist input to change the situation, to treat or manage
The cases that have come through. That is very insightful. Right, so question number 2 is, how have been the efforts from your different perspectives in terms of the different areas that you have done research in, and just depending on your hats, whichever hat you're wearing, how would you say the efforts are progressing in addressing the fight against drug and substance abuse?
Thank you. So I think the drug use disorders, or the drug use, some would like to call it an epidemic or pandemic, but whichever term you use, but there's been multi-sectoral efforts to actually deal with the issue of substance use. So there are a lot of organizations, institutions, government facilities that are actually putting this cage that we have now in the fore. So in terms of the efforts that have been done, so it's actually a progression. So when someone starts to use there are primary preventative measures that we take. So primary prevention, we're talking about delaying onset of use and trying to stop people from starting. That's where the key thing is. It's actually cheaper to do collective discussions, like focus group discussions like this one, so that you can disseminate the right information and people can actually stay away from the drugs. So one bad side or one downside to this era that we're living in is there are now new concoctions. It's more of a buffet of different drugs now. It's different from old times where people had just a small list of drugs. So we now have a lot of drugs that are there on the market, and the level of experimentation is way too high, especially considering that we're in the information age. So in terms of the efforts, I would say the primary preventative measures, in terms of drug demand reduction is, I think awareness programs have been going on through schools, workplaces, through churches, through voluntary organizations. So this is an effort to actually mitigate, to stop or mitigate people from not starting the use of substances. So I'll move on to secondary preventative measures. So secondary prevention, it pertains to someone who has already started using, but he hasn't developed a disorder. So we are trying to mitigate to help that person not to develop a disorder, or to eventually cut down on the use so that they can actually live a healthy lifestyle. So various organizations have been in that space. So we look at civil society organization, government, schools, colleges, workplaces. They have actually been playing a part in actually mitigating as far as secondary prevention is concerned. So we also have tertiary preventative measures. So doing tertiary preventative measures, we're saying someone would have already developed a disorder. So these ones, they now need specialized services. They also now need institutional care. So in terms of institutional care, I think there's quite a great effort that's being done. I think we now, in terms of our directory of centers that are offering this service, we have now quite a number, and more centers in the private sector are opening every month. Then also in government, there are a lot of efforts are being made converting idle facilities to become specialized centers, and also trying to identify these facilities at provincial level. And we have what is called the Pledge for Action. Zimbabwe has also pledged to take action to the UNODC, and in a year's time we should be having one specialized rehabilitation facility running within each province of the country. You know, we have 10 provinces, so these will be major referral centers that will be running. Then also to add on to that, we have what is called the continuum of care. So care is supposed to be stepped down. You are supposed, if you have developed a drug use disorder or substance use disorder, you are referred to, if you are still intoxicated, you are referred to an acute setting. Acute setting, we're talking about a hospital where you are stabilized. Let's take for instance Paranato Annex. Then after stabilization, you continue with your detoxification, whether that acute setting or you are referred further on to a drug rehabilitation center. So those are the key centers that we're establishing now. Then thereafter, from the drug rehabilitation centers, you're supposed to progress to what is called a halfway home. We're just seeing a midway from being discharged from a specialized facility to going into the community. So this is more of like life skills training, putting your routine back in shape, being able to take care of the roadblocks to your abstinence. There are quite a lot of group and one-on-one interventions that are also involved, and also vocational and livelihoods training also comes in at halfway homes. And then thereafter, we are trying to address, because there are three major factors that actually hinder someone from maintaining sobriety. So especially if you look at these basic amenities like food provisions, employment, and also housing. So if you don't take care of these basic amenities for people, that means there is always that risk of relapse that is always there. So from step down care, we move from the halfway facility. We can actually refer you to a livelihood training center. We're actually in the process of creating those, or even a vocational center. So also there are some people who tell you that the neighborhood that I'm coming from is not really a safe neighborhood to go back to. Yeah. So there are some people, especially in the private sector, who have established what are called sober homes. So these sober homes, you come in, you check in. It's a more of a supported living environment. So whereby you come in, there are people who are there who also want to stay sober. So there are no therapeutic services, no interventions done there. You go to work, then at night you come and report back at the sober home so that you're able to be supported within that environment. So there are a lot of interventions and a lot of efforts that are being done. So,
Yeah, thank you so much. I feel like that is so much information. I hope you guys are taking notes, right? Yes. I'm busy sitting with the hair. How does it feel? Like feeling like a, you know?
Yeah.
So can you take us through the last question? So what are the effects of drug and substance abuse amongst the youth in Zimbabwe? As a fellow young person, yeah, what do you think the effects are? What have you experienced or seen the effects are?
Yeah, during the integration activities that we do at ActionAid, we've managed to identify a lot of effects due to this use of drugs and alcohol abuse in our society. We also have major issues of even committing suicide. Some could even develop mental disorders. Some could even try to engage into their like crime rates. You see it increase due to the use of these drugs. So this thing is affected us as young people to make even informed decision about our sexual reproductive health rights. It also made us not to be aware of the surrounding, which is going to emerge to risky behaviors, so that we can also be exposed to new HIV infections, you know, STIs, etc. So this point is also affecting us internally as young people in terms of our livelihoods. So you won't be able to be accommodated in an employment situation whereby you are a drug addict. You know, you also be a discriminated person, someone who's not even welcomed in the society. So these elements will end up creating other avenues that is going to expose us as young people, because we don't have anyone who's willing to welcome us and accommodate us during our situations. So I think it's got a lot of issues around there.
All right, thank you. And from our clinical psychologist, any additions to what's been said?
I would just want to encourage the community, us to start talking about substance abuse more from a supportive point and stop being a derogatory narrative. Let's talk about what's missing, how can we be supportive, what can we do, how can we help. Just acknowledging that once I am an addict, it's difficult for me to just stop. As much as you might lecture me, I can't do it on my own. I need somebody to hold my hand and walk with me through that process. That would be my last word, and just emphasizing that preventative work is better, definitely. But if we are there, let's be supportive.
All right, thank you. Now we're moving on to a section where we're going to ask the people in our audience to ask their questions. So please can we have the first person who'd like to be the first one?
Good afternoon, my name is Samantha Isaac. My question, ndofunga patakaita research yedu, vanhu vazhinji drug users vaipindura kuti zvonizvo drugs kwaari kubva, kuti isusu tizomashandisa ari kubva kwakuru. Saka ini mubvunzo wangu uri pakuti ndezvipi zvatingaite kuvandudza mutemo wenyika mukuedza kupedza kana kuparadza dambudziko.
So thank you. So one thing I would want to give you first, what is called a global overview of the question that you have asked. So the drug world is quite it has got a lot of money in it. So and all levels of the society are prone to the temptation of taking the money from the drug world. So there are measures that are supposed to be taken so that you actually solve and remove the rotten apples more within the community. So in every society, even if you take for instance United States of America, they invest trillions into the fight against drugs. So it's actually a fight with no end in it. So what I would say in our current setting is it's important that we acknowledge that we have porous borders, and a system also, we need checks and balances within our system also to make sure that everyone doesn't take money from this world. But however, going forth, I strongly believe that besides setting up mechanism to nip in the bud where the problem is coming, I strongly believe that we also need to fight it at every level. So supply reduction, that's the area that focuses on dealing or mitigating to stop the supply of the drugs. Over enforcement sometimes doesn't really stop, it just sometimes upgrades the way that people are actually trafficking the drugs. So sometimes punitive measures are not always the solution. So a clever system strikes a balance so that they don't over-invest in punitive measures. You understand? Because what happens is, like, there are some old age problems that we've always had. I'll take, for instance, prostitution. The more you over-regulate the area, I would say good Canary Chinzi drop-in center. We're saying good government capacitates my CSO like ActionAid. Understand? ActionAid creates a community-oriented or a drop-in center where people who use drugs can come in and get ARVs, they can get condoms, they can get counseling, and they can get referrals to other services they need. And where we have done our exchange programs, we visited places where they actually provide even TVs, places where people can sit and talk. So this is more of like creating alternatives to already what is already happening there. So we acknowledge that yes, these people are using drugs, but our interventions also don't have to be punitive and too restrictive, because the more it becomes restrictive, the more the drug world steps up its game. You understand? So maybe I'll add more to it. Maybe I'll revert back to you.
That's a lot to take in. A base. I need to find a base. Is that right? Next question, please.
Afternoon. My name is Gladys George. My question was, panewo here zvamuri kuita kubatsiridza avo madrug users acho?
Would you like to answer that one, Miss Stella?
That's a difficult one in terms of what are we doing. There's a big campaign that's going on at the moment. I think on radio, we've listened to the media, my billboards, where people are trying to highlight these are the problems that you face and these are the alternatives. So giving information, there's a lot of information giving and trying to find alternatives for people in terms of, well, I don't have anything to do, so maybe we can do vocational. So this is very much dependent on different organizations that are coming up and offering alternatives. There's a big network that people can access where you can phone in and ask for help, and you'll be directed to the nearest service that's available in your area.
So adding on to what my colleague has already talked about, I think we have to put it in terms of priority. Yes, she has talked about prevention, which is very important. It's actually key. So it's actually very cheap to implement preventative measures than to do one-on-one treatments with people who would have developed what? Substance use disorder. So you find that we have a priority that we usually use in terms of interventions for the people who would have developed a substance use disorder. So the first priority, like she has already alluded to, is we prioritize education and giving information. So that's the biggest finger that we have there. So secondly, we do psychosocial support. So there are various interventions that come under psychosocial support, including some of the techniques that need to be trained on, like motivational interviewing. Then the third one is strategies to reduce harm. We have to mitigate so that harm is minimized. Because harm, if it's not minimized, the threat of having that person's life taken is always too high. So you'd rather want to protect the life first. Also, the expectancy in terms of survival of that person has to be also lengthened, so that you're able to save the life and also protect the others that you also stay with. So harm reduction also comes in on the third finger. Then also we have the program for caring for carers, which is very important, because with substance use, your parents get easily frustrated, is it?
Yeah, it's true.
Because you would have stolen the TV,
Exactly.
your parents might be in the diaspora, you sell all the furniture. They can't even just sell the house because they don't have the papers, is it? But they can sell anything, even the TV you're watching. So that's where the problem is. So also our interventions will take care of those people who are taking care of the people who are using drugs.
It's a lot of information. I'm learning a lot today. Yes. Question number 3. Do we have a question number 3?
My name is Alexio Sandi. My question is basically divided into 2 categories. So my first question is, how can mental health services can be accessible to the public? That is my question number 1. So question number 2, kune vaya vanenge vasina zvikwanisiro, for example munhu anenge auya aine mental health issues but anenge asiri financially stable, zvekutoti zvinenge zvatoonekwa nana mazvikokota kuti munhu haatori mentally stable, so munhu munokwanisa kumubatsirawo sei?
So zvikwanisiro should never be a deterrent of seeking mental health services, because mental health services are free. The government offers free services for anyone who wants to be treated. Saka, your local clinic is your first point of call. Sometimes, yes, you might get into a space where maybe people are not very aware, but there's a big campaign nationally to try and make sure that all clinics are ready to help any patient who comes in with mental health conditions. So the campaign is very much there. It's a gap that has been recognized, and there's a national campaign with the Ministry of Health trying to ensure that every clinic has somebody. And depending on where you are, we also have services like Friendship Bench that have really helped the community health workers to try and help people to access mental health services.
So what the emphasis now is, we want to move away from institutional care to community care. So in terms of our intervention pyramid, at the base of it is community care. You understand? So all interventions should be hinged strongly within the community setting. So what we are encouraging is, I understand where you're coming from in terms of mental health services and provision of service. Yes, there's quite a lot that needs to be done in terms of number of institutions, yes. But what we want to encourage also is our community intervention. That's why it's so important to always emphasize on the prevention aspect. The prevention aspect takes care of most of the bed that will actually go to institutional facility. So what we are trying to do now is to strengthen services in communities. That's why you have a lot of trainings that are being done for CFW. Although we are yet to regularize and standardize the content of the trainings, but a lot of work should also be given to the CFWs. Adding on to what she has already said, that with the Friendship Bench model, so this is more like a community-based approach, and the cadres that actually deliver the service are actually community cadres, community health workers, people with no expertise, that are also like you can actually engage in this program. So another issue to add on to, I think you mentioned about institutions and accessibility of service. Yes, I agree. At the moment, we're trying. We have very few mental health referral centers, especially they are available within cities, mega cities of the country. So the drive now is to sort of like decentralize. So establish institutions in various provinces, even in the rural areas. So also the issue that comes to someone's mind when we discuss about this, about the cost of service. So we are trying to also make sure that we establish these facilities even at local authority, even at rural district council level. And we are trying also to make sure that the costs are not a major issue, so that everyone can actually be able to afford. So what we are trying to do is we strengthen the community support. We capacitate all community members to have basic knowledge about drug use and being able to know where to link that person to an appropriate service. So that's what we're trying to work on.
All right, thank you. So we've heard we are all able to go and reach out to somebody for our mental health, right? Any more questions? Yes.
From the discussions, from the research, it, some of the responses were like, the drugs that young people are using, they are coming outside Zimbabwe. So my question is there anything that is being done by these countries, maybe SADC countries or UN, to fight drug and substance abuse, to stop drug trafficking?
Take that.
So what has been happening, I recently attended a SADC, it was more of a traditional leaders training in South Africa. So there is concerted effort, regional effort to actually curb the distribution path of these drugs. Like, if I may add more to it, the most common drug, I think for a century, it has been, the poppy plant, the one that you take, opium. So opium is the one that makes all these other drugs, heroin, methadone, and all the other opiates. So what happens now is, comes from Afghanistan take it thereabout, and if you have the world map in your mind now, it goes down to Africa. So all these countries that are around the supply chain are getting what is called spillage, and they get the drugs at a cheaper price. And fortunately for us, we are landlocked, the distribution pathway, and we are not a transit country. So those are some of the advantages that we have. So some countries are getting the spillage, and then it goes up into the Americas, like North America, South America. Then you also look at the same with cocaine. Cocaine comes from the coca plant. You get it from the countries like Colombia. So its pathway, it goes down from the Americas down to Southern Africa, then it goes to Europe. So that's the pathway. So what's happening now is there is a regional effort. So we have organizations, we have the UNODC. So with the UNODC, we also have the African Union. It is actually now officers, most of the department that deals with that. The same with SADC. So all the regional bodies now have these bodies that coordinate efforts, and they're trying to make sure that all the interventions are done at every level, from community to influential people to training of chiefs, training of nurses, standardize even the way we screen for people who use substances. So we're trying to actually standardize so that my data is same with someone's data from South Africa. So I want to go to the issue of the drugs that are actually trafficked through our borders. There is actually a sort of a gradual transition. We are used to drugs that are distributed. So one thing, there is actually a field of drugs that is actually growing, the synthetic drugs. So you find that crystal methamphetamine, the ones, the Torino that you're taking, it's a lab created formula. So we find there's going to be a transition over the next couple of decades. So people are going to be locally living their homelands, you understand, and doing their drugs, so that the supply doesn't really have to focus on the borders. But as of now, I agree with you, the drugs, they're coming through the borders, and you find that the drug world, since there's a lot of money in it, a drug lord can be richer than the whole town, you understand? So those people, they are well resourced, so that makes them a step ahead of our enforcement measures. Sometimes, as we are planning right now, there's a new drug that is already circulating, you understand? By the time us, the authorities, and us, the learned and the other interested parties know about it, it's already, it has already gone around it. So you find the drug world is always a step ahead. So what needs to be done, that's why we want to emphasize more on prevention. Because not only supply will deal with this, because the field is well resourced. So supply will always be coming. I know some people would want to give typical examples of this country. We actually have there are some countries where they have worse off corruption cases pertaining to drugs. I'm not saying we're clean, we have our own issues, but I'm saying the problem has to be looked at globally. So going forward, I strongly feel let's try to impede entrance of this drug, but let's try to deal with people by educating them. Then after dealing with it, let's provide services at community level. There's another important aspect that I left out. There's what is called informal community care, where you don't have the expertise to deal with someone, but you know how to take care of someone. You understand? Like let's say we're in winter right now. If someone knocks out because they were taking a sedative, sometimes it's always good if they are cardboard box, you just take them and you cover that person. You understand? That's informal. You know that person is going to die because of hypothermia. So, but you just take the few cardboard box and cover that person. Then if there's anything that you can do, maybe phone the people at home, put him in a wheelbarrow, take him home. Those are informal community care. They are not like a sophisticated book stuff that you have to learn, but taking care of community members. You know that very well. I saw your daughter, she's actually passed out, maybe in a pavement or on a pavement or something. So then I just do my role as all the people that are supposed to be helping. So those are some of the skills that you can change. And we find that we have the skills, the necessary set of skills that are necessary to get someone to where they need help. We have them. So it's more about you look, you listen, and then you link them to the appropriate set for them to get. So thank you. I hope I sufficient.
All right, thank you so much to our panel, our invited guests, say our VIPs. Thank you so much. Do we have any more questions? No, we're good. Yeah, sure. There's nothing in the inside of the pagati of the. Yeah, good. Ah, fantastic. So here we have parting shots from our great panelists.
Just reinforcing that the disorder is amongst us, the habit is within our communities, but we can do a lot within the community. We should not wait for the government or big institutions to come and help us. As individuals, within our families, within our churches, we can talk about this and just make it part of our lives and start doing the little preventative work that we can do. In some churches, for example, I know we have health days. Make that part of the agenda. Let's talk about substance. Let's not make it sound like it's something that happens next door. Let's acknowledge that it's happening within our own families. And we can go a long way in removing the stigma and helping people to come forward to get assistance.
Yeah, I would like to thank ActionAid for capacitating us as young people to conduct this feminist research. You know, it's an empowerment program that came as an advantage to us. Amongst our youth who conducted the research, about 20% of them, they were also drug users. But now they are no longer using the drugs. It's through these interventions and this community capacity building things that ActionAid has been conducted. So as young people, we are now capacitated to do local initiatives, trying to advocate and do things that to do away with drugs. And we also conducted some road shows and other peer-to-peer interventions that we are also doing in our local communities. By so doing, we are trying to engage them and gain more knowledge. So I'd like to thank ActionAid and our panelists for even sharing more information. I think I've learned a lot that I'm going to even develop our interventions for the next time.
Alrighty, thank you.
So my parting words would be on community solutions. The solutions are within communities, and what we need to do is capacitate. So we capacitate with the right information. We capacitate with being able to communicate. I know life sometimes, especially in the ghettos, is quite difficult, and it's very dangerous to be a snitch.
You lose your life or other things.
So we have to find ways of actually communicating and be the guards of our communities. And all solutions are within us. And people who use drugs, they are now forming their own networks, which is good. So they also need to be heard what they're thinking. And I know most people would want to say that common statement, say no to drugs. But how would someone say it? So it's much broader than just saying no. You understand? So you have to be capacitated with the right knowledge and be able to know at this stage that the person is, how may I be of help? So let's create solutions within us. And there's no one size that fits all. You understand? You have to come up with broader solutions because the drug world is a spectrum. It's from zero use to 100% lethal use. And so our solutions have to also be broad. And don't be fixated on one solution or one way of solving the drug world. Like, let's arrest. There are people who are fixated. And let's arrest. Let's throw everyone in jail. And after throwing everyone in jail, the drugs will be used in jail. You understand? Then another person say, let's pray about it. You understand?
Yeah.
This is the way, your way of dealing with things. But you have to accept with drugs, you have to appreciate the multiplicity of solutions that come along. So accept interventions. Some may be new, but let's try to always use the evidence-based interventions that have been proved that they work, but always be able to accommodate other ways of solving the problem. Thank you.
All right, thank you so much for joining us. I think as we're rounding up our first ever episode of Kick Out podcast, I think we're all wondering what ActionAid is, who they are, as well as this Hopley research that we keep referring to. So make sure you tune in to the next episode to hear about it. I've been your host, Rati, and have a beautiful and blessed day, evening, night, morning, wherever you are. Thank you. Are we good? Are we done? Thank you.